It's great to be able to follow Chris and Craig. I've worked with Chris before. We're going to be doing Vegas, I think, in a few weeks. But getting an opportunity to work with the clinical, the laboratory, and the sort of the medical side together is great. So I'm going to try and talk to you a little bit about stroke neurology in the context of what we're doing here in Victoria, some of the research work that we're doing as well. But I want to also try and put stroke in a bigger context. There's a reason why I use this shark, because if we had somebody killed by a shark off our shores, it would be all over the paper, right? That's one person. If there were 50,000 people mangled by sharks in a year, we'd probably think we had a significant shark problem. And if it was the largest cause of adult disability, we'd probably have something that we were doing to try and stop that. And I'm not sure if we have had that kind of response that we should have, the same kind of response you could have expected if sharks were responsible. So 50 years ago, we started building coronary care units. That's places where you go if you have a heart attack, and that's a heart. And here we are 50 years later, and I can't say that we have anywhere near the kind of response for the brain that we see if you have a problem with the heart. So why is that? Are we just, the poor cousins, or we just don't do a good enough job? Why? What's been wrong? Well, the times are changing, and I think that the new era is arriving where we're going to start to see interventions for the brain which start to look like what has been possible for the heart. But in our defense, let's try and think about why we haven't done a very good job of dealing with the brain. Well, when the heart doesn't work properly, it hurts. You get crushing chest pain, and it goes into your arm or something like that. And then you know that you go in an ambulance, you rush to the hospital, and the emergency room physician goes, chest pain, and then he does an ECG, that thing's up, and he does a blood test, that thing's down. And then it's figured out, you need intervention. When the brain doesn't go right, it's a more eloquent organ, and so there are more things that might not work. You might recognize some of these characters, but they evoke some of the human talents that we have in art, music, and physical activity. So if part of your brain stops working, what is it that you can't do any longer? Is it a stroke? Is it a TIA? Or is it just a bad day? Do you need to go to the hospital? That has been the problem. We're dealing with this much more eloquent organ, and so understanding it in an appropriate time has been difficult. At least that's been one part of the problem. The other part of the problem is we haven't had an ECG and a troponin. So my cardiac colleagues get to do an ECG, a cardiogram, and that shows you've had a heart attack. And they get to do a blood test, a troponin, and that shows you've had a heart attack. It's just not that easy in the brain until now. And what you've been seeing in mice, some of that sorts of new imaging is starting to appear for brain. So these are just a few examples. This is new CT technology, which is 3 pictures of the brain. And you add them all up and you create this one here. What that picture says is the red part, it's gone. Can't do anything about that. The green part, it's hanging in there. If you open up the vessels, we can salvage that. So we've got ways of being able to look at brain now in the acute stroke, that is in the first 3, 4, 5 hours, and make decisions about whether or not we can do some plumbing. I can't tell you that science is perfect yet, but we're getting there. We've at least got the tools so that we can learn how to do that. And I don't mean we personally here worldwide. There's a big drive to understand how to use this kind of imaging. And there's other sorts of imaging which is appearing, images which tell us where the nerve fibers go. It looks kind of like a mohawk or some kind of funny haircut. But that's actually imaging which shows the fibers in the brain. And other sorts of imaging which looks at the chemistry of the brain. So there's a number of new ways that are emerging that we can look at the brain. So let's talk a little bit about stroke, a little kind of quick primer. This is the heart. This is the brain's blood vessels, and this is the vessels, the carotid arteries, vertebral arteries going up to the brain. And one of the other problems we've had at not keeping up to our cardiac colleagues is that there's a whole lot more ways that your brain can stroke out than you can have a heart attack. You're working with a lot more diseases. So there are some kinds of stroke which occur when the heart throws a spitball up into the brain. Atrial fibrillation, I dare say there's a number of people in this room with atrial fibrillation. So that's one of our big providers. Cardiogenic embolism, if we could get rid of this, we would really be well ahead, and it's a big target for us. So stroke where blood clots come from the heart. And then there's another type of stroke where the tiny little blood vessels up in the brain, up these little guys up here, they just kind of snuff out because they've been worked too hard. And they don't give you a big stroke, they give you a little stroke. But you may end up having many, many, many of those. That's what happened to Stalin. That's why Stalin lost his marbles. And then there are strokes where the blood vessels get damaged for some reason. The most common reason is you get atherosclerosis, cholesterol, diabetes, high blood pressure, smoking, all of those Western sins combine together and clog up your arteries. So they can clog up so you can have a carotid narrowing, and little bits can fly off that up into your head. And in other instances, a big blood clot can just form right inside the brain, particularly if you are oriental extraction. That's a type of stroke that happens more in the Orientals. Or you can get unlucky, like Chris, and actually tear the blood vessel. That's our main source of stroke in younger people. And we're seeing more and more of that. We didn't even know that was happening in the past because we didn't have the technology to show what was going on. And there's probably way more of it out there than we ever realized. So those are kind of the large artery kinds of things. And then there are people who bleed into their brain, intracerebral hemorrhage. That's about 12% of our strokes in this community, bigger in other communities. So instead of a blockage, there's a rupture of a vessel and blood spills into the head. It can be very nasty and very fatal. And then for 30 or more % of the patients, we don't actually even figure out where it came from. And in that group are a whole host of new things that we're beginning to realize. Migraine gone awry, where blood